Mr Speaker.
Porto Williams.
Thank you, Mr Speaker, and I actually want to start my contribution where the member who's just resumed his seat has left off, and just talk about, I guess, what happened 14, 15 years ago when the conversation in the sector, in the health sector, was about the competencies that someone required in order to do a good job. And I remember the conversations that were held when I was working in community health and community mental health about the extraordinary work that nurses in particular were capable of doing, that their scope of practice was such and their training was such that they could be engaged in a wide range of health provision. And it was at that time that the then Minister of Health was introducing the discussion around the ability to train nurses to take higher functions and take on the roles as nurse practitioners. And I remember the discussion very distinctly because nurses were very much in demand because of their scope of practice and the ability to work in such a significant way that they were being taken to do other work kind of outside of the clinical practice in a way. A lot of them were taking roles as managers of services, particularly health services, and there was a real pressure on New Zealand health workforce to be able to offer a range of services that were at a level that was sufficiently high enough to be challenging for certain practitioners, but not those duties specifically of a medical practitioner or a doctor, but getting pretty close. And I recall the discussions that happened at that time. So it's taken us some time really to catch up with the actual practice that's happening in the community, or what should be happening. And this bill, I think, Mr Speaker, has brought us to a place where we can now address what is current practice in New Zealand. I think we've kind of missed an opportunity to future-proof ourselves in terms of what will be future practice for these practitioners with the advent of the advancement of technology. But what this legislation does do is it actually allows for the scope of practice to occur as it should do. So nurse practitioners are the ones most often quoted, but there are a range of other practitioners for whose practice can now, we can now encourage a range of career pathways for these practitioners. Specifically, Mr Speaker, they are going to be able to legally conduct some statutory functions which have been denied to them in the past, and we've already heard the examples of being able to sign death certificates. What they will also be able to do, and this is important in the mental health field, is to be able to conduct assessments where psychiatrists or psychologists are not available to conduct those assessments. And that's really important where we have situations, say for example, where the police may have picked someone up, or someone has become unwell and is having an episode, and you're unable to get to a psychiatrist or a psychologist quickly. Health practitioners will be able to conduct those assessments and be able to have people into treatment relatively smoothly and quickly. There are some other examples, for example, the assessment of children with regards to their roles within the care environment with child, youth and family, and one or two other aspects of their job. The report back from the Select Committee, and I do want to echo the work of the Select Committee, it often has very complex issues to deal with, and this was also a relatively complex bill. But the report back from the Select Committee recommended some changes, defining what a nurse practitioner actually does, which includes what type of practice certificate they must hold, and that they are governed under the Nursing Council and the Health Practitioners Competency Act. Changes in definitions from doctor's surgery to medical surgery, medical centres, and various other things, particularly under the Mental Health Compulsory Assessment and Treatment Act, the ability to actually be the provider of those assessments. Mr. Speaker, the previous speakers have actually outlined the significant parts of this legislation and how it amends the other 7 pieces of legislation, and I don't think that there is much more that I need to contribute to this bill. We're happy for it to be passing into legislation, and we commend it to the House.